Hi everyone.
Hello.
My name is Teresa Liskay and I put together a healthcare forum because I put together a healthcare forum sponsored by the College Democrats because I am interested in healthcare and the current system right now. So I thought, what better people to ask than the healthcare professionals? So thank you so much for coming. I want to especially thank Paul who helped me, Nishan, and my guests. I'm going to let them each introduce themselves. So.
Hi, I'm Cindy Brewer. Hi, I'm Cindy Brewer, and this is my first time for being in front of an audience outside of my office, so please forgive me if I stutter or whatever here. I've been an office manager, well, no, let me start over. I've been in the medical field for about 27 years in the medical office setting. So I've had about 6 years experience as a actual receptionist, 5 years as a billing manager for a group of 4 physicians, 6 years of billing managing for hospital-owned physician groups of 12 that ranged from family practice, GYN, occupational health, and I'm sure a few others that I can't remember right now. I've also had experience with being an office consultant, working also in a nursing home billing setting for about a year. Currently, I'm at my current job as office manager for a group practice of 6 physicians and 1 physician assistant, and that's been for about 8 years now. So, that's it.
I'm Mary Jo Gross. I'm a physician with a board certification in family practice. I have worked approximately 20 years in private practice where I owned my own practice with a partner, managed 2 offices. I have worked 17 years as jail physician, some of those as director of jail medicine. I have worked a few years at urgent care as well as directing urgent care for Community Mercy Health Partners. 7 years as director of student health here, and a few months as a hospitalist, and that probably adds up to 90 years old, but some of those have run concurrently. I have been studying healthcare policy for the last 5 years, not formally in any program, but as I've studied medicine, which is to say through the evidence and the research presented by leading institutions both in our country and around the world. This started actually as a request to give a talk on healthcare reform several years ago, and has developed really into a passion for me because what I learned from studying the evidence is pretty amazing, and I'll share some of that with you tonight.
Hello, I am Stephanie Little, and I teach psychology here at Wittenberg, but I've also worked on and off as a mental health therapist in Tennessee as well as here in Ohio for the last 20 years, and most recently I have been working part-time at Osterland Services for Youth to work towards my licensure as a clinical psychologist here in Ohio. So I'm here as kind of adding the mental health perspective to healthcare and healthcare reform.
Good evening, I'm Rob Baker. I'm a professor of political science and urban studies here at Wittenberg. But I'm actually on the panel not as a healthcare provider, but as the president of the Rocking Horse Board of Trustees here in Springfield. And I've had 12 years experience now trying to make sure we have health care to those who are underinsured and uninsured and at risk in this community. And I have a lot of experience with trying to make sure we fund that and fill in the gaps as the healthcare insurance in particular, but the healthcare industry has gotten more costly and more difficult to provide. So that's the perspective that I'll share. And there's a suggestion in the paper that I was going to talk about a campaign platform because I am a city commission candidate, but I don't know how it got in there. This is a national debate, obviously, that's affecting all of us at the local level. Policy-making decision is in the Congress's hands and the President's hands. I don't know, city commissions or city councils around the country making the actual decision, but I will say this, I mean, local governments, just like any organization, are wanting to make sure that their employees have good health care and that they have access to good health care and they have good insurance benefits. And to the extent that health care insurance costs have gone up, that's strained every government budget, local governments as well. And so I'm certainly concerned about that. And as a citizen, I'm concerned about making sure that our citizens in this community have good health care. And part of the reason I've been so active in Rocking Horse for so long is that I feel like it's been sort of filling the gap there. So my role here is as an activist and board member, president of Rocking Horse Board.